There's the slowing of reaction time, lethargy, and passivity. Reproductive. Marijuana use is associated with infertility, fetal loss, and congenital anomalies. Mental status. Euphoria, paranoia, anxiety, and heightened sensitivity to external stimuli. All that, plus the controversial issue that marijuana use may lead to the abuse of more potent drugs. So, what about care for clients suffering from substance abuse or mental illness? Therapeutic care, to be specific. We'll begin by discussing individual therapeutic modalities that focus on the needs of the client. They can be supportive, educational, or reconstructive. The purpose of individual modalities is to treat mental illness by helping the client gain insight and self-knowledge, decrease stress and anxiety, and deal with crisis situations. Supportive therapy, play therapy, varied therapeutic modalities, crisis intervention. Supportive therapy provides a safe environment in which to explore problems and make decisions. The client's coping skills are reinforced, and the therapist does not attempt to teach new coping methods. Play therapy is specific for children as a way to express fears, feelings, conflicts, and aggression with playful activities. Children tend to act out their feelings rather than communicate them. Varied therapeutic modalities can facilitate communication for clients. Activities with art, music, poetry, and recreation provide the client with alternatives to promote insight and problem solving. Crisis intervention is short-term, usually 4 to 6 weeks, and focuses on solving immediate problems. The focus is to reestablish coping patterns and problem-solving abilities. Crises offer opportunities for growth. Life events can be viewed as potential crises. Maturational crises occur at a new stage of development. Situational crises involve a critical life problem and arise from an external source such as job loss, death, job change, pregnancy, or severe illness. What do you think is a priority assessment in a crisis? That's right, safety. Safety is a priority and the primary focus. Here are some sample questions for addressing safety concerns. Have you considered killing yourself or someone else since this problem began? What do you think might happen now? Assessment strategies include defining the problem. Has anything upsetting happened to you within the past few days or weeks? What leads you to seek help now? How are you feeling right now? How does this problem affect your life? Next, it's important to determine available resources. Who do you live with? Who can you talk to when you feel overwhelmed? Who is available to help you? Assessing coping skills in a crisis is also important. What things help you feel better? What did you try this time? What was different this time? What helped you through difficult times in the past? What do you think might happen now? Possible nursing problems for crisis intervention include ineffective individual coping, altered thought processes, and anxiety. The nurse must work to maintain the pre-crisis level of functioning. During a time of crisis, clients are often more open to outside intervention than during stable times, and therefore can learn different, adaptive coping methods. As a nurse, your role is to be active and directive and focus on the present problem and the immediate crisis only. Family therapy is based on the belief that the behavior of one family member affects the other members. Your role as a nurse is to help families to identify and express their thoughts and feelings, to define family roles and rules, to explore and try new, more effective ways of relating to each other, and to unite parents as cohesive leaders of the family. Families who experience emotional difficulties usually have communication problems. Communication problems include discounting or ignoring each other's communication. They may scapegoat one of the family members and blame problems on that individual, or triangles may be formed to relieve tension between two family members. That's why nursing interventions are directed at the family as a whole and their behaviors, not at an identified client. Let's consider the Smith family. The family consists of the mother, father, 14-year-old daughter, and 11-year-old son. It's the first family therapy session. The daughter has been withdrawn recently and spends a great deal of time in her room. She's not interested in her friends and prefers to be alone. The son has ADHD and continues to struggle with his schoolwork. Last year, he barely passed 5th grade. Let's see what the nurse is observing during this session. The nurse should notice where everyone sits, who seems to have the power in the family's rules, how parents interact with each other and the children, sibling interaction, relationships between parents and children, each person's behavior during and in response to the meeting, the expression of feelings. Communication among families includes discussing painful events or family problems, clarifying members' thoughts, feelings, and messages, dealing with anger openly and non-judgmentally, connecting feelings and facts, never blaming, expressing empathy for family members, sharing homework activities such as planning a family vacation, doing a fun activity together, or eating meals together. The session went on to reveal that the parents disagree and argue about whether or not their son should take medicine for his ADHD. The father says to his son, "What's wrong with this family?" and that he should just buckle down and work harder. But the mother says he needs to take his medication to focus on his work. So what interventions would help the Smith family? Helping them discuss rationally their views about the benefits and risks of the son's medication and reaching a decision together. Encouraging family members to be open to and listen to the daughter's ideas. Asking members to brainstorm ways to help their son succeed academically. Giving them homework assignments that involve having fun together as a family. There are many types of educational and supportive groups. An individual's behavior in group is thought to imitate his or her behavior in other group settings. The role of the nurse in groups is to facilitate the group so that group members can give input about how the client represents himself to others. It's also the nurse's role to help the client gain insight, try new behaviors within the safety of the group, and accept responsibility for his behaviors. The content of group includes the words or discussion of goals and tasks. The process of the group focuses on relationships among members and how they communicate with each other. Let's review the characteristics demonstrated in successful groups. Installation of hope. The client believes that he will get better through the group. Universality. The client learns that other group members have similar problems and feelings. Imparting information. The client learns didactic information in a group setting. Altruism. Clients help each other within the group, resulting in increased self-esteem. Corrective recapitulation of the primary family group. The client's background influences his behavior, and the client can relive and correct early conflicts. Development of socializing techniques. Clients develop social skills in the group. Imitative behavior. The client identifies with and imitates healthier behavior of group members. Interpersonal learning. The client's interpersonal distortions are corrected. Group cohesiveness. Clients experience bonding with the group and learn and observe group norms, and protected and positive client outcomes result. Catharsis. Group members express feelings, even deep and powerful emotions, and then learn new ways to handle their problems. Existential factors. Responsibility, existence, awareness, and mortality are explored. These characteristics could be exemplified in support groups, educational groups, and family groups. Think of how these characteristics exist within your own peer groups and your class or study groups. You can even observe them in action at the dinner table.